Guys, we're going to be speaking to Dr. Kapil Keshup. He's our El Jefe of anesthesia here. And he's going to go into what he looks for in you being healthy enough for anesthesia. Take it away.
Appreciate it, Dr. Jeneby. So there's many things we look for to make sure you're a good preoperative candidate for plastic surgery. First of all, we may want to find out, are you on any medications? Have you had surgery before? How do you do with anesthesia? Then if we do find out you're on any medications and do have some medical history, then we decide, do we need further consults to make sure you're ready, or is it something minor that we don't need further consults for? Want to make sure your heart is good, want to make sure your lungs are good, we check your airway, we listen to everything, we examine everything, we look at your blood work, make sure your hemoglobin's okay, be ready in case we need to use cell saver. We have a lot of things available, a lot of things that we look at. And as always, your safety is our #1 concern.
Tell us what happens when you see somebody who's vaping, smoking, nicotine. How does that affect anesthetic?
We don't like any of that. So one of the things that a lot of smokers don't realize is that when you smoke, the cilia, or vape, the same thing, the cilia in your trachea are the little cells that help clear your secretions. Smoking stuns those. So those cells will no longer clear your secretions. So one of the things that you can get is you can get a pneumonia from having been put under anesthesia. So it's very important, get good habits, prepare yourself for surgery, help us to help you have great results.
And somebody who is BMI's over 38, what are the unique problems?
And again, morbid obesity, it's a problem in America. It's something we have to address. Your risks on almost everything go up as your weight gets in the morbid obese category. So you're going to have multiple health problems. If you wait and let it go, you're going to get diabetes, you're going to get hypertension, you might get sleep apnea. So there's a lot of things that we look for that we try to prevent. So we have screening, and we tend to not do patients that have BMIs above 38.
What about somebody with like really bad heart condition or something wrong with their lungs or heart?
Yes, absolutely. If we see someone that has multiple problems or is in advanced stages of heart disease or lung disease, we will get a consult. We immediately, the first thing we'll do is we'll have a cardiologist consult, we'll get a pulmonary consult. If your kidneys are not working as well as we like, we will always get a consult, make sure that you're clear for an anesthetic and a big surgery if that's the case.
So there you go. We are safety first. If you saw my Hulu special, it's on this website. We are not, we are 10,000 and 0. For over 10,000 cases and no deaths.
We like 99.99999.
We want 99.9999999, no issues.
Yes.
And we may turn you down. Oh, what about drugs? Cocaine, methamphetamine, heroin.
One thing a lot of people don't realize is that everybody here is getting
Adderall.
drug tested.
Yeah.
So a lot of these drugs interact with the anesthetic drugs we give, so everybody gets a urine drug test. And we want to make sure that you're ready for surgery. So if you are doing things that you shouldn't be doing, you need to stop them a month in advance.
Right. So again, now you're hearing it straight from an anesthesiologist. We'll put this on our website under Don't Smoke, Don't Vape. Again, we're going to get lots of people saying vaping and all this BS is good for you or it's better than smoking. You guys forget that it makes no difference to us. You're still smoking.
We never want to cancel your surgery. We only cancel it if it's for your safety.
And again, if you need to talk to us, Dr. K is here. If you want to direct a question at him, he'll be more than happy to answer the TikToks through Joe John here or myself.
Absolutely.
You did.